All right, so today, the objectives of today's presentation, we're going to start off with just a brief review of the normal neonatal kitten. And the reason I want to include this is I feel like, we, especially as veterinarians, we don't necessarily get to see neonates all the time in practice. And so having a rough idea, I know whenever I see a neonate, I have to always remind myself, like, what is normal for a kitten or a puppy of this age, so that I can therefore kind of figure out everything from that point on. So I want to kind of go over that. Then I want to hit some of the common diseases in neonates, because again, without seeing them that frequently as veterinarians, we tend to forget sometimes, or we don't remember all of the real common stuff. So I just wanted to go ahead and go over that. And the old adage is common disease always occurs commonly, so we should all have a good handle on that. And then we're going to go over some of the care of like the sick neonate, and I've kind of divided it up into thermoregulation, fluid support and catheterization, medication administration, feeding, and then just briefly touching on blood transfusions for them if necessary. And then finally, I'm just going to, just for a couple of slides, talk about serial monitoring and what you can do serially in the hospital when these patients are there and what you're looking for to change over time. And this is actually such a timely talk for me because Sunday, 3 days ago, we had he was 17-day-old puppy come in on Sunday that's still in the hospital right now. So I actually had to review some of this stuff myself just on Sunday because this little puppy came in. But today we're talking about kittens, not puppies. So I wanted to start off with a poll question, and I think Lynn is going to take it from here as far as the poll question, and then we'll go from there.
Okay, of the following areas, which are you most interested in hearing about today? The review of normal kitten, review of normal disease, fluid therapy, feeding interventions, and transfusions. So please click on the screen for your answer and submit it. Do not put it in the Q&A box, please. Just click on your screen, submit your answer of the following areas. Which are you most interested in hearing about today? And since this is a pretty straightforward question, we're going to just jump right to the results. Well, I think we have a neck-and-neck tie for the ones that people want to hear about the most, Dr. Tomoski.
Okay, great. Good. Okay, so that's interesting because I can, blab on for longer about certain things or less about others. So, okay, great. So I actually have quite a bit on feeding, which is fantastic. And then, normal disease I talk about a lot too, so that works out perfectly. Great.